Okay, so thank you for everybody for logging in for the meeting today. If we make a start, apologies for absence. Item number 1.
Yes, Chair. We've had apologies from Jeff Beard, our adopted member.
Okay, lovely. Okay, so moving on, declarations of interest. Any declarations of interest? No show of hands? No, okay. Moving on. Item number 3 is Councillor Andrew Barry wants to come into the meeting a second, so I'm just going to admit him. Bear with me a sec. Andrew, are you in?
I've already let him in.
I am. How are we, Shan?
Hi, Andrew. Welcome. We're just on to agenda item number 3. You haven't missed anything, Andrew. We've only just started.
Thanks, Shan.
Okay, so agenda item number 3 is focus on the future. This is obviously the Living Well strand of the 4 strands that we visit through the year. And today is to consider the report of the Chief Officer of Social Services. This agenda item has been brought forward in place of the Citizens Advice Bureau item, which unfortunately had to be deferred. I understand Citizens Advice are having difficulties with resources, so they couldn't send anybody or do anything. So we've deferred that item, which we will revisit that later on in the meeting. The report seeks to demonstrate the performance of the service areas against the outcomes set down in the corporate plan. Additionally, this committee has asked for information to be included in the report so we can identify the impact of the ongoing pandemic is having on social services. We've asked that to be an ongoing theme through all 4 strands. And for today's meeting, the primary goal for members in relation to this item is to receive the report, to provide constructive challenge to its content, to secure assurance on it meeting the needs of the living well themes. And additionally, the committee is required to draw out through questioning, the impact of COVID on service delivery. So on that note, if it's okay with Lisa, I'll hand over to Lisa to do a brief introduction of the report.
Yes, that's fine. Okay, so this is the Living Well theme update for 1920. So as you'll be aware, our objective was people are empowered to live independently within their communities where they're safe and enjoy good physical and mental health. So there are, the background is there are 2 acts, obviously, we follow the Wellbeing of Future Generations Wales Act 2015 and the Social Services and Wellbeing Act 2014. I'm not going to go through the entire report, but it'll just be some sort of edited highlights really. So where we were, 2017-18, there were 9 wellbeing objectives at that time, and for social services, the Living Well theme was split into 3 wellbeing objectives, and they were developing safer communities, people having good physical and mental health, and people living independently. So what we've done is pull those 3 themes together into one sort of objective. The evaluation of our performance for that year was adequate. There were obviously areas of improvement, and we clearly sort of saw that, and that's been developed into the improvement plan, which I'll come on to. Where we are now, the 1920 focus for the long term is that people live safe and independent lives within their communities. Children and adults are safeguarded from harm and feel safe, and children and young people live safely with their family or close to home and have transitioned well into adulthood. So they're all themes that we're looking at within the improvement plan and making sure that we're providing safe and support to the families we work with. The Living Well strategy on a page is in the appendices, so you'll see that and all the details that we're looking at and what the sort of main focus is for us. There has been some sort of delay in the annual performance data for 1920 because of COVID. Welsh Government were sort of stipulating in March that they weren't expecting us to get the same data in as we had in previous years because of COVID. So usually we'd have updated data at that time. So we've been sort of delayed in some of that, and Welsh Government have asked for different data this year, which we provided on a weekly basis. So we've sort of, our performance may be slightly different the way we evaluate at the end of the year. One of the sort of areas we're looking at, obviously moving forward, is that of prevention. So you will have seen sort of this year, because of COVID, an increase in demand. So there's high demand for packages of care for people leaving hospital and requiring support in the community. So we saw an increased demand in that in 1920. There was a dip in that for 2021 because obviously some families didn't want support because they didn't want to put their families at more risk by having people in their homes. So we'll see a slight decline in that. And we've also seen an increase over the last sort of 12 months in our looked after figures. But again, in this financial year 2021, we've seen that sort of stabilise, so that's some positive news. Early intervention prevention is obviously key to us sustaining the long-term future. So we've seen the development of the early help hub that's gone live in the last year, 18 months. And we obviously have developed the Stay Well at Home service. So Stay Well at Home 2 has gone live in adult services. Again, looking at sort of supporting people at early stages rather than them coming to a care home setting. Safeguarding has remained a priority throughout, so that's obviously prioritised, and you know, we're working on that in a timely manner, and referrals are being dealt with. The 5.12 in the report outlines the details of our improvement plan. So that obviously looks at sort of our recovery, the resources and service improvement, and resilience and sustainability. And clearly the element for us in the plan is about improving our resilience moving forward, because I think we've developed the service over the last couple of years, but it's making sure that we're able to do that in the future and keep it going. In October 2020, we've had a Care Inspectorate Wales performance valuation inspection, which covered both adults and children. It was a very stressful time, as we could have, you know, it was difficult when we were just on the back of the pandemic. But I think managers were fantastic and really stepped up to make sure that, you know, we worked well with the inspectors, and the feedback was really positive. The written information has come through and is still positive, because sometimes what they put in writing is slightly different to what they say verbally. But I think the important message was they felt that Merthyr Tydfil Social Services was a safe service, and that was good to hear, you know, a really positive message. I touched on briefly sort of the COVID pandemic. I'm happy to answer questions on that, but I think, you know, okay, the service hasn't been the same for the last 9 months. We saw a decrease in referrals at the start of the pandemic. What we're now seeing coming through is probably more high-level safeguarding concerns, but they are being dealt with in a timely manner. We're agile working more now, in that staff are working from home and they're speaking to young people online. That is one of the positives that come out of it. Young people are more engaging in their LAC reviews and conferences because they feel more confident speaking online as opposed to being in person. So that is something that we can build on, and that's something that John Eyre is looking at, certainly from point of view of conferences. Stay Well at Home 2 was developed as part of the Transformation Fund. There was some delay in that, because obviously the Transformation Fund was delayed coming through because of COVID, but that's been quite positive. And we were lucky in Merthyr, and we were able to appoint to most of those posts, albeit on a fixed term basis, whereas other authorities weren't so successful because the numbers for us were lower. We've got triage processes in place with regards to when the fire break comes in, or whether there's been a change in the rules and regulations. Those guidelines are sort of updated quite sort of regularly, so that staff have got clear ideas about what they need to do and, you know, how to keep themselves safe. PPE is provided to all staff, and nobody is visiting without the appropriate PPE, and that's really important. And we have regular communications with staff throughout. I think that's the same for both adults and children's services. Care homes have been really impacted, not so much in sort of wave 1, sort of March to June, but certainly since September, the care homes have had a real impact this time on COVID. Most of them have had positive COVID cases. As we've seen an increase in the community, and in the hospitals, we've seen an increase in our care homes. So as staff are being tested on a weekly basis, any signs of symptoms, whether it be a headache or high temperature or a cough, they are sent home straight away. They have their temperatures taken before they enter home. If it's high, then they're sent home. We don't take any chances. We've sadly had 4 deaths within our care homes, 2 in Tigurnos and 2 in Tbargoed. But we've also seen residents who've tested positive of COVID also recover from it. So that's really positive. We've had one lady who was hospitalised but has since been about to be discharged. So, we are not seeing a huge impact at the moment. Obviously, when staff become ill, we have to then cover their shifts. So that's been difficult at times, and we've been reliant on agency staff or staff doing, more than their contracted hours. So part-time workers might be working full-time to help us out and things like that. 6.7 to 6.20 outlines the financial position for both children's and adults. Obviously, adult services is slightly different to children's services in that we've had the hardship fund and other funds coming through for COVID, whereas children's services haven't seen the same financial impact, although we are starting to see Welsh Government responding now to the high demand. So there's been some finances coming through for children's services in the last sort of couple of weeks. The lessons learned part of the plan, then obviously agile working is something that we're moving forward on. Partnership working, certainly with health, has been really positive. And we're obviously using any of the learning to plan for the winter pressures, because we haven't just got COVID to deal with, we've also got flu season, and winter is always busy for us. So with COVID on top of that, then obviously that's going to be an increased demand, and I think that's something health and our department are working really closely with. Where we want to be, that's outlined in 7.1 with sort of the details of how we want to work under the Social Services and Wellbeing Act. 7.2 outlines the sort of details of my annual report, which has been submitted to Welsh Government. And that's sort of details sort of some of the plans for the future. And then obviously what we need to address, well, we continue to work with the improvement plan. We'll continue to work with our CIW action plan. And any sort of supports moving forward. We'll also look and review at lessons learned from COVID working and continue to work regionally and through partnership. I know that was a whistle-stop tour really of the report, but I'm happy to answer any questions.
Okay, so if we go over to questions now. So I've got a hand up with Clive, so that's the only hand up at the moment. So over to you, Clive.
Thank you, Chair. I've got a few questions. On page 8, under 5.4, it refers then that you state we will deliver these outcomes by focusing on our priorities for improvement. 1, improve early intervention and prevention. 2, reduce the number of children looked after. And 3, enable a greater number of adults to live independently. Are we on track with that? And if not, is COVID affecting that situation?
Thank you for the question, Councillor Jones. I think we are working towards that, whether we're on track, because I think COVID has had a huge impact on us this year, and we can't get away from that. Our LAC strategy or the LAC numbers are certainly stabilised, and we are meeting our reduction targets. So whereas Welsh Government were concerned about 6 local authorities, we are not one of them with regards to our LAC figures. The reality is, though, we have to safeguard children, and if they need to become looked after, it's not about numbers. So we have to make sure that we are providing appropriate care and support. We are developing the early intervention and prevention for both adults and children, and we've continued to do that. So regardless of COVID, we have made developments with Early Help Hub and Family First, and certainly around funding around grants area. And the transformation programme through health has been really supportive to move the adult agenda forward with prevention. However, although we've made some steps forward, it's been slower than we would have liked because COVID has had an impact. So whereas transformation, we were looking at getting that up and running sort of from the 1st of April this year, some of those projects have only recently been set up because we weren't able to get the staff in. You know, we weren't able to go live when we wanted to. But, you know, I still think, you know, we'll look back next year and realise that we've achieved quite a lot. Although at the moment it probably doesn't feel like that. Lowry, Taryn, do you want to add anything to that?
I just feel that it's probably useful to share with the committee in terms of children looked after numbers, that in 1819 our monthly rate of children becoming looked after stood at 7.7. We've currently reduced that down to 5, which has shown quite significant progress. During the height of COVID, our children looked after numbers did go up to 224 at one point, and as of today sit at 213. And it's important to put that in the context actually where there's lots of revocations that we're waiting to go through court, lots of final orders have been delayed. So whilst it may not on paper be the progress in terms of numbers that we would have desired, lots of groundwork has been undertaken to help us move forward, and I do feel that we've made significant progress given the current context really in which the service is functioning within.
And if I can just add from an adult's perspective, in terms of enabling a greater number of adults to live independently, we're currently working collaboratively with our partners in housing on the development of an extra care service for individuals with a dementia and individuals with a learning disability, and that's progressing well as a housing and social care solution for some of our most vulnerable residents, and that seems to be progressing well at this stage.
Okay, Clive, did you have another question?
Yes, if it's okay, I've got a few more.
Of course.
Thank you. On page 9 of the report, paragraph 5.8, in the middle of that, it has been referred to by the officers, but it says there in a quote, there's also been an increase in our children looked after population from 198 as at the 31st of March 2019 to 208 as at the 31st of March 2020. And I think it's Lowry just given us the figure that it's 213 currently today. Was that increase expected, or this is something that can, as we all know, varies from year to year?
I think Councillor Jones, is fair to say that those things are variable, and as Lisa highlighted earlier, actually when children need to be safeguarded, then the local authority have a duty to take the appropriate action. Once again, what I think is really important that committee aware of is the rate at which children are becoming looked after in Merthyr has declined. The rate in which orders are being revoked or children are coming out of the looked after system due to delays in the court process has slowed significantly. So whilst we've reduced the level of children entering care, there is a backlog of cases currently that are waiting to go through the court system. Also, we have a particular team at the moment that are looking at revocations for children who are under an order that they're under care orders, but it's placement with parents. So they're placed with their parents, but they are technically looked after children. And we are doing some work with that pool of young people who sit under that order at the moment to see whether revocations are appropriate, which would have an impact upon our looked after figures.
Thank you for that. And as I understand it, there is an enormous backlog of cases for the courts because of what's happened over the last 8 to 9 months. That, as far as you know, does that mean that it's taken nowadays a much longer time for these cases to be determined by the courts? What effect then does that have on the individuals and the staff dealing with those cases?
I think there's a number of points really to make. Firstly, that our priority is always about making sure that those young people are safe and families are well supported during that time. And I feel very confident that the service is achieving that. what I would say is there's probably two aspects to look at. There is a backlog within the court system at the moment that we are seeing some signs that that's starting to ease, and some revocations and court cases are starting to conclude. But naturally that will take time to go through that process, and the Welsh Government have announced some funding for the local authority, as with all local authorities, to support that process. Secondly, there's probably more of an issue around during the COVID period, lots of other services haven't been functioning as they normally would, which has meant that intervention work hasn't occurred as they normally should. So not only are we waiting for cases to go through the court process in terms of timing and court availability, there's also a backlog in some of the work that needs to take place so that we can evidence to the court that actually the order that we finish with is the most suitable order for that young person.
Thank you. I've got another question. It's on page 11. It's under paragraph 5.14. It's about the 7th dot down. And it says in there, these are under the strengths areas for development. And I quote, need to continue to review caseload numbers for social workers. Are you able to tell us, Lisa, what is the average number of caseload for the social workers, and what should it be?
Okay, it's always a difficult question that because adult services teams generally have a higher caseload than children's services because of the way they work with cases, and some of the cases on the caseload would be on review, so they wouldn't actively perhaps be visiting weekly or doing sort of regular visits, whereas on a children's caseload it would be an actively worked case, so you would be having regular contact. In an ideal world, a social worker should probably have a caseload of about 20. I say that, I mean some would be sort of 15, 16, and a high caseload I would have thought is in the region of about 30. There's various sort of numbers across the service, I think, with regards to caseloads. For the most part, the intake team, certainly in children's services, have had the best sort of size caseloads that they've had for a long time. They worked on the backlog and closed down cases that need to do, and I think their average caseload is around about 16, 17. The longer term teams, some of those caseloads are higher, but it sometimes then goes down to experience of a social worker. So somebody newly qualified, you would expect to have a smaller caseload, and somebody with more experience, they might have a higher caseload. The difficulty is in the numbers, is that you might have one social worker who's working with 5 families, but they could each have 4 children, which their caseload is 20, but they're clearly working with 5 families. So it's not as easy as me sort of saying to you, if 20 could be 20 individual children. So I mean, in an ideal world, they'd have a low caseload because obviously they're working more intensively. And I think caseload size is probably the best it's been for a long time. So I don't think there's a major concern about that at the minute. But obviously we'd like to improve it in the longer term teams. I'm not sure if that answers your question, but Taryn, Lowry, do you want to add anything?
Just to add that the feedback from the recent inspection that we had in the letter that we've received from Care Inspectorate Wales does identify that caseloads, whilst busy, staff consider them to be manageable, and I think that looks very different actually to our 2018 inspection, and the point that you've noted, Councillor Jones, is from the 2018 inspection. So when comparing both inspections against one another, you would see that there's been significant progress.
Clive, are you okay with that?
Sorry, I was waiting to see if anybody else was coming in. Yes, thank you for that answer. The next question's on page 12, and it's the last but one dot under paragraph, if I can get it, 6.3, and it says there the CMT agreed the outline business case for additional resources, including social worker, support workers, and foster care placements for cases where a parent or parents are in hospital. Did you have you got that for social work support workers, and how many were they, and And on top of that, were they budgeted for?
Okay, the specific point you refer to there is with regards to when we were originally in lockdown. There were a number of examples, and there was one sort of in our local region, but not necessarily Merthyr, where parents had been taken ill with COVID and hospitalised, and there was nobody to care for the children. And what we wanted to do was be ready if that happened in our area. Touching lots of wood, that never actually happened, and we didn't have to utilise it. But we were ready with an emergency team, and if we needed to, that we'd have support workers who would step in and social workers, and we set up a bed at Thomastown House that if it needed to happen and we couldn't find an appropriate placement, there would be staff in support around that child and family. So we did it sort of for a local. For Merthyr, but we also looked at a regional sort of commitment to that. We also had a foster carer who was on standby to take a child who potentially could have been COVID positive. So they were on retainer then. So the resource was there, although we never actually had to to properly use it. So the budget would have come out of the COVID hardship fund. So that was sort of agreed.
Thank you. And my last question is on page 14, Chair. Under 6.17, the financial implications, and it says that Children's Services have worked with a service accountant and have quantified the projected financial impact on this period until December next month has been currently estimated at £85,720. Is that monies that would you have any of that money is covered by any COVID grants from the Welsh Government, or is that amount there 85,720 having to come out of the cost of running the Social Services Department? I note the last sentence there, it says 11,922 has been reclaimed from the General Social Services Hardship Fund for COVID-19.
So part of it, like it says, 11,000 has been reclaimed from the COVID fund, but the rest is sort of the impact on us, and it's certainly something heads of service and directors have been flagging with Welsh Government, in that they've been quite generous, certainly since March, for adult services in helping around the costs around care home placements and dom care packages, to make sure that we'd be able to sort of keep elderly people safe, but there wasn't the same financial support for children's services. So certainly we're pushing that agenda, and in the last week or so, I know heads of service have had a presentation, and directors have in the last week, from Welsh Government about what extra funding is going to be made available to children's services. So going forward until the end of March, there are various grants that are going to be made available to help us with some of the impact that we've seen in the increased cost. So hopefully some more of that will be covered, but at the moment only 11,000 has come out of the hardship fund.
But you're hoping for some more to cover it from the Welsh Government.
Taryn, do you want to add anything to that? Because I know you've had updated information since me.
Yeah, I think it's fair to say, just for committee's awareness, that the costing is currently embedded in our spend, so that is not an addition. We initially were of the view on the guidance that we were given that we could claim more against the COVID fund than we were initially allowed to do so when we put in returns. We've revised some of those returns and resubmitted them and asked for further clarity from the Welsh Government, because we consider that they were COVID related expenses. And further to that, they have recently told us of quite a considerable sum that will come to children's services over the next 4-month period, which will offset in some of our further costs that we may incur, and also allow us to look at some of that backlog of court work and do some preventative work moving forward.
Thank you very much, Chair.
Thank you, Clive. Okay, if we go to Harvey, I know he's been waiting a while, and then we'll do Declan, and then I notice Bill's got his hand up as well. So if we do Harvey, Declan, then Bill. Over to you, Harvey.
Thank you, Chair. Lisa, I put this question to you or Taryn, whichever one of you wants to try and answer it. you, at the beginning of your report, you talked about the improvement plan, and that's where my question is coming from. Now, on page 6 of the improvement plan at 5.11, and I haven't got my agenda in front of me, but what I did was scribble down a few bullet points to take me through the actual question. But I noticed that in July of this year, the council published its improvement plan. And the main overarching aims of this plan, if I'm reading it right, was that, among other things, we are talking about improved outcomes for people. Now, the plan then goes on because it's broken down into 3 areas, of which one of the areas is the resource and service improvement plan. Now, within that, what I consider to be the largest of the 3 pieces within the report, there are 9 projects. And I'm looking at this and I'm asking myself the question, surely to implement each and every one of those projects that make up the 9 is going to come at a cost. Now, I don't want you to go through the 9 projects and talk about them in depth, but one project that I took from the list is, and I quote, to develop further support for carers. Now, obviously, we all know that it's the headlines at least once a week on the news. So what do we actually mean within that project, Lisa or Taryn, of what, what this is all about as far as carers are concerned? Bearing in mind what I said about the cost.
Okay, thank you, Councillor Jones. Okay, so there are 9 areas that you've sort of referred to, the resources, and one of those is the carers area. So they were all areas that we were looking at, and they were things that had been picked up by previous inspections about what we needed to improve. And there's a regional carers group, and we knew for Merthyr we needed to improve the offer to carers to make sure that, carers who perhaps didn't have formal support, those are informal carers, that we were targeting those and they were being able to access the right amount of support. Now, we had a carers officer in Merthyr for some time, and that post was vacant for about probably 18 months, if not longer. So originally it was sourced with VAMT, and that wasn't necessarily working for us. So we brought the post in-house. We did recruit, but then that person never sort of came to fruition and never came to Merthyr. And I think we went out to advert a couple of times, but we were unsuccessful. We've been successful this year now, and we've appointed to that post. So in the past, that monies would have been going into the vacancy factor. So it's not an additional cost for social services. That money was in the budget. So that person now will take the lead for carers, and she will develop the carer service, working with the regional strategy. So there's been, when we did the population needs assessment, we looked at what carers needed. That was one of the areas we were looking at, and they were prioritising sort of some things we need to move forward. COVID in some ways has helped us because we've identified now that some carers would, rather than have a direct service, would rather have direct payments. So we've seen an increase in that. So, the carers person will now take forward, work with VAMT, work with the third sector, look at what services are out there in the community, get out there and sort of do the communications and making sure that those unpaid carers are accessing the support that they need. And certainly there's been funding made available by Welsh Government for unpaid carers in recent months because of, COVID. So that's something then that, Rachel, who's our carers officer, can target. So I think there's a report or coming to Cabinet this week around carers and the update on where we're at with carers. So it's been a really positive couple of months in that we've now got somebody who's, you know, going to focus particularly on carers and move that agenda forward with no extra cost, because there will be grant funding that will come through from the region.
Thank you, Liz. Thank you, Chair.
Is that all, Harvey?
Yes, yes.
Thank you, Harvey. Okay, so who did I say was next? Declan, I think, wasn't it? Councillor Salmon, over to you.
Lovely, thank you, Chair. Really, I think I might be following on from a little bit what Harvey mentioned in the beginning. How much is this going to cost to put right the 9 points that were mentioned in the report? My first question is it's on item 2 in table 1 of 5.6, and it's the percentage of adult protection inquiries completed within 7 days. Now, looking at if you're looking at the percentages, it might be a bit shocking from 89% down to 75%. But I see the figures of the actual inquiries have gone from 147 up to 263, which is quite a lot, which an awful lot. So I'm asking, because in 1920 only 75% of people had their inquiries answered within the 7 days. Are inquiries, are they prioritised as to how serious they are? And then the big question is, has there been any serious implications as a result of 25% of people not having their inquiries answered within the 7 days?
Okay, thank you, Councillor Salmon. So I mean, it is worrying that the figure's gone down. I appreciate that, but that doesn't mean to say that we're not dealing with adult protection inquiries. In fact, the CIW inspection recently was happy with sort of the information we gave them and said our service was safe, and had seen some improvement since our last adult inspection, which was last year. The numbers have increased, so you'll see that there's been a huge increase in adult protection cases. So the 7 days usually is sort of, it targets those that have been completed within 7 days and finalised. And sometimes it's not as simple as being able to answer that query within the 7 days. So, you know, we might ring Mrs. X. She doesn't want to consent to an adult protection referral. We may have concerns about that person, whether it be financial or, you know, other concerns, and we'll still want to look at that inquiry, but we can't do it without the adult consent. So, you know, there's lots of things that need to happen. Sometimes it just means that those discussions take longer than 7 days, in which case, obviously, the recording will happen on day 8 or 9, but we don't hit that target, if that makes sense. But it doesn't mean that we're ignoring it. It's just basically still an open case, and we're still working with our adult protection case. One of the things that did happen with regards to the previous inspection was that they were concerned about capacity within our adult services MASH. What we've got is, so John is our safeguarding lead. He's the principal officer level, and within adult services, because it's set up differently to children's services, there were only 2 adult officers. So at any given time, if one went on leave or one was on sick leave, then that added huge pressure on the system, and there was no resilience. So hence that's had an impact on some of our figures. So in that case, when one person has been sick, we've had to prioritise. So those high-level adult protection have been dealt with sooner rather than later, and then others would sort of perhaps, you know, looked at outside of the timescales, but still dealt with, which is why you'll see an impact in the figure this year. So we then recruited a support worker to help with some of the police referrals that were coming through. So perhaps domestic incidents of older people that the police would have logs for, and then the support worker would be looking at some of those PPNs. So that helped us out with sort of capacity, but also following the sort of second inspection, we've had agreement and we've now appointed a senior prac role in there as well. So we've now got 2 additional posts into adult protection. So for this financial year, so hopefully you will see an improvement in that figure, because obviously it's been flagged as a capacity issue, and we've had to put extra resource into this. So there was additional cost there. moving forward, but that was part of the corporate capacity exercise because we knew that was an area that there was a gap in. Does that answer your question?
Yeah, and I've just got a little follow-up one on this one. Why have we seen such a big increase? What are the reasons behind it?
Some of it is around sort of awareness raising. So last year, Safeguarding Awareness Week always has a theme. So, you know, we target sort of themes around older people or whether there's children. This year was suicide. So I think there's been a real big sort of awareness raising around safeguarding and older people. Certainly with the new regulations, with the new Act, there was more focus on adult protection, and there was a lot of change about the expectations about people reporting and what came through. So I generally think people are more proactive now at referring older people, whereas in the past I think there's been more of a focus on child protection and not necessarily adult protection. But the new Act puts a real sort of focus on adult protection.
Lovely, thank you, Lisa. My next question then is it's on the third item of table 1, and it's percentage of people that received the right information or advice when they needed it. Approximately 70% of people received the right information. 30%. Does that mean 30% have received the wrong information, or which is quite disturbing? Obviously, we've mentioned staff and levels, so I presume that's why as well. And you mentioned earlier that the figures, the data is late this year in some of the things. Is this likely to improve? Because one would think that in 2017-18, when 70% of people received the right information, you'd improve, and obviously you wouldn't be able to improve straight after. So will that figure improve this year?
Hopefully we'll see an increase in that statistic there, the data, but it's related to adults and children's services. So it's about sort of us processing, so making sure that they use Early Help Hub, or whether it goes to Intake or MASH, or the single point of access in adult services. So it's making sure that we're signposting people in the right way. I don't know why that figure is low. I mean, ideally, we'd want that 100% if we could, and certainly our target is quite high. But it doesn't mean we're giving them the wrong information. It just means that, you know, perhaps, you know, somebody accessed the Early Help Hub and then was referred to Team Around the Family or Intake. We maybe could have done it differently and acknowledge that later down the line, which is why we're constantly looking at structures and how we give information and things.
Okay, just pick it up on something you said there. Would the figures be affected by someone not taking the help that you offer?
Honestly, don't know the answer to that. I mean, ideally, what we'd want to do is stop cases escalating. So if somebody came in and we referred them to Team Around the Family, then we wouldn't like to think then that wouldn't work and they'd come into statutory service. But obviously, we can't make somebody listen to the advice when it's voluntary, you know, and when it's not mandatory. Once obviously it comes in statutory section, and whether the child's on the child protection register or looked after, then, you know, there's going to be legislation they have to follow. So.
Okay, thank you, Lisa. Chair, I've got one little question, and it's just I want to know what it means. It's on the same table as the percentage of children. The percentage of children supported to remain living within their family. Can you just explain what that is? Is for 1920, 475 out of 681 were supported. Did that mean the others didn't need support, or?
No, it's basically those that we haven't removed from their families. So those children haven't become looked after. So we've managed to offer children support without having to take statutory action, and they become looked after.
Right, lovely. Thank you, Lisa. Thank you, Chair.
Thank you, Councillor Salmon. Okay, is that all, Dick?
Yeah, that's all. Thank you.
Okay, Councillor Smith.
Thank you, Chair. Only one or two questions, Lisa, on the funding on page 10. where it said the service have increased, but the funding is getting lower. Tomorrow night is a report on the council on social services underspent for the coming year. With that money, can we use that money to safeguard what we're doing now? And also, don't forget, the comments we made earlier on with councillors from Councillor Degan and Clive Jones is that sometimes we haven't got the proper staff in place. Can we have a look at it and use our funding to support what we're doing for the next couple of months? Because the Welsh government's not going to fund all this for every day. So we got to get our act together, and don't forget when the vaccine gets in, it'll be slowly, but we'll still have problems taking place.
Lisa, before you answer that one, could I just come in on the end of Councillor Smith? Because I had a question and it was related to Councillor Smith, so it makes sense to sort of put the both together. Mine is also relating to the budget. You know, I've just made a few notes as we've been going through. So we've seen a reduction in looked after children, which historically has been one of our main causes for overspend in that particular budget. And I understand, if I've understood it correctly, it's not necessarily that we will be underspent. It's just the fact that there's almost like that budget is on hold, and we may very well see that expenditure further down the road, if I'm right in what I've understood. So I just wondered how it relates to the overall budget. So we've seen a reduction in one with looked after children, but an increase in others. So I just wondered what the overall picture is likely to look like at the end of the year, really. So that's why I just felt it was better to come in with Bill, because it's all budget stuff.
Okay. I'll do my best to answer that. Okay, so at the moment, the report that's going to council shows that we're about 120,000 underspent. The reality is that changes month to month. So the report that I took to Scrutiny last month showed an overspend in my budget line. So if we'd carried on like that by March 21, then potentially I could have been in an overspend position. The budget is really, really sort of fragile, and it changes sort of week to week. It is difficult to budget sometimes, but we do our best. What we've seen at the moment is that there is an overspend in the residential budget, because we are still seeing a real high demand for that. There is a project called Closer to Home, so we're looking to reduce that budget moving forward and get children out of residential and either in foster placement or back home where appropriate. Not always easy to do that, because we're talking about some really complex children and young people. What you've seen in the budget is that there are some budget lines that are not being utilised because of COVID this year, and that's the difficulty and the unanswered question. So the IRE budget, so the independent residential sector, there are a lot of vacancies within the sector at the moment that can't be filled because of the 28-day rule. So if a home has had COVID, then they can't place anyone from the hospital until that home has been free of COVID for 28 days. So there's placements there, but we can't use them. At the moment, there are probably, not all hours, I hasten to add, but 150 patients from various hospitals in Cwmtach Morgannwg who need to be discharged either into the community for packages of care or into care home setting. I think there's probably about 40 of hours that we need to work with about, and we are working with health on that, but we are stuck because we can't place in some of the homes. So obviously at the moment, we are not therefore paying for a package of care or a high cost placement in a care home. So that budget is showing an underspend. However, come December, when we've started to get those people out of the care homes, and we might, you know, those care homes are out of the 28-day rule, hopefully, then we'll see a movement of patients, residents from hospital into care home setting. Then the cost of that budget line will increase for us because we'll be expected to meet that package of care. So therefore, by the end of December, I may not be in a position where I'm 120,000 underspent. I could be, level, or I could be overspent. Similarly with children, there are budget lines that are reduced. in that our independent fostering agency budget line, we were successful in getting more young people and children placed in-house or placed kinship carers with family. So we saw a reduction in that budget line, and there are expensive foster placements, for want of a better phrase. But obviously that underspend balances off the overspend in the residential budget line. Also in the care homes, we've been impacted with, having to use agency staff when, our staff are having to isolate. So obviously that impacts hugely on the budget because those staff are more expensive, and we have to pay by the hour. We also lost a manager with, not lost, that sounds like they died, sorry. They went into isolation because they had COVID. So we needed to put management cover into one of the homes, and that was an agency worker, which obviously was more expense. So it's so difficult at the moment because it's so volatile. I pray every day I don't get a call to say, somebody's been hit with COVID. I think we've been pretty lucky in the teams because they're, agile working and they're isolating and they're doing, rota basis, and they're not having that direct contact in the office. We are not seeing the teams depleted like we have seen the care homes. Plus, they're obviously not providing the same personal care. So the budget's quite sort of, volatile at the moment, but we just obviously continue to manage and deal with it as we can. And does that answer your question? Sorry.
Councillor Smith?
Yeah, sorry, I asked the money that we save in it, because I know we're going through, like, it might not be an underspend, but it might be, won't be an overspend, might be an underspend. Will that money be kept in social services to help us to keep some of the staff for next year?
Yeah, I'm not sure I can answer that question, Councillor Smith. As much as I'd like to say yes, any underspend will come back to me.
That's all I want to know, yes.
I'm not sure if I have the power to say that. I know that we're looking at as some of the project plans, there may be extra funding required for that, and maybe that's something we can look at, whether that some of that money will be recycled. But I think that's probably a corporate management and a sort of cabinet discussion moving forward.
Councillor Smith,
only a second. I know got the cabinet member for finance, but can you look at it in the next couple of months and come back?
Councillor
I'll
Barry?
certainly raise it, yeah.
Yeah, thank you, Chair. Thank you, Bill. Yeah, we're in crazy time of year now, where grants and all sorts of additional funding will appear. The latest figures that I hold are obviously on the last outturn figures, where we're projecting to the end of year £65,000 underspend. Within that, there are 3 looked after children looked after in residential placements. I don't know whether that's changed now, Lisa, whether we're still on 3 or whether that's increased or decreased. The truth of it, Bill, is social services will get the funding they need. In terms of our outturn at the moment, we're projecting an underspend of 504,000. We expect that we'll do okay in the settlement, and that puts us in a position where we can support social services to whatever level social services need to be supported. The difficulty is, as Lisa so well put it, was we just don't know what's going to happen. We've had many conversations in budget board about the looked after children position, and that budget line has an ability to sideswipe any budget predictions that we may put in place, and we simply don't know what the pressures are going to be going into the back half of the year. But certainly as we speak, social services budgets are in a healthy position. Difficult to say where we go. We will undoubtedly have some additional funding towards March and up to March. We should be okay. That's all I can really tell you, Bill. I think is where we are is quite a healthy position in terms of the overall year.
And sorry, I'm just flagging it up because I am a bit concerned as Chair of Scrutiny. Me and Lisa have discussed this in the past, and things are increasing. It's not only after the COVID are gone, but attitude of parents, parent training, parenthood, and all, and children, everything's changed. It's getting a bit worse. It's getting a bit naughty after lockdown. People think they can do what they want to do, but they can't do it.
Yeah.
So it's a knock-on effect.
I think you make a good point, Bill, and it's just a case of there's so much uncertainty at the moment. I mean, we can't even make a real judgment call on medium-term financial plan at the moment, simply because there's so much uncertainty, and the area of work that you refer to is uncertain more than most. So we can just see how it pans out. You know, we can't make those long-term judgments. We can only say what we have in front of us. We're in a healthy position at the moment, and social services will get the funding that it needs.
If I could just come in there, Bill, just to say that I think there's a one of the things that Taryn and Lisa have alluded to today is that there are solid reasons why those budgets are underspent, and under normal circumstances they would never ever be underspent. So I think that we need to be mindful that those issues, and in my opinion, those issues won't just go away. They may very well come back, and come back with a vengeance, because they've been sat there quietly for the last sort of 6-7 months. So I think what I would suggest, and what I would certainly recommend as chair, and if you want to sort of do this, Bill, is that we ask that be a recommendation that if there is any underspend, that it is definitely ring-fenced and kept safe for social services, because these issues will no doubt come back. So I'm happy to do that as a recommendation.
Chair, I support that, because my link with social service as the chair of social service scrutiny. Do you hear me? I'm mute or froze. Do you hear me, Liz?
I can hear you. I think Tanya's frozen.
Yeah, I thought I froze a second then.
Tanya's saying her PC just turned off.
Oh, okay.
I don't know who's the deputy.
Should be back on, am I?
Is it Gareth? Gareth Lewis, Councillor Gareth Lewis.
It's okay, guys. I think I'm back. I think it's back. Bear with me. It just literally went off. I've got no screen a second. Bear with me.
Bill's waiting to come in, Tan.
Okay.
No, I'm all right. Sorry.
Yeah,
knock it off.
Can you see me now?
Yeah.
No, you're still frozen, Tanya.
No.
Am I? Oh, can you hear me at least?
We can hear you, yeah.
Okay, as long as you can hear me, that's that. Don't worry if you can't see me. That's probably a good thing. Where were we?
Support your recommendation.
Right. Okay. So if we ask that to be recorded in the minutes, and we'll have it as one of the actions that we can follow up on in future. Maya, are you okay to record that? You there, Maya?
Yes, Chair, I've made a note of it.
Lovely. Okay. So, Bill, was there any other questions?
No, I'm quite happy. I'll make a comment after questions on.
Okay. Any other questions? Okay. There was a couple of things that I had noted down, Lisa. You've covered most of them. It was just a little query on 6.9 on page 13. It said, due to the vulnerability of the majority of people who are supported by adult social care, this one might be better for Taryn, actually. A number have chosen to cancel services to limit the number of people who have access to their homes. So I just wondered whether that has had any impact on job security, or whether we were looking at future redundancies or anything like that as a result.
No, it hasn't had any impact on staffing. We offer support where we can. Those who obviously haven't wanted to have dom care in their homes, then obviously that's up to them. I think the biggest issue probably was the dom care services, which is a tender that we've got regionally with RCT. So those staff have been utilised into other, things when they've needed to. And although the hours have gone down that we've paid for, it's been more of sort of cost that we've saved, and then that's been refocused onto direct payments rather than hours of offering dom care. So there's been no staffing implications at all.
Okay, thank you for that, Lisa. And just one other thing, it was something that came up when you were talking about the 28-day rule. I picked up on it when I was reading the report, and it was out of curiosity, why 28 days when everybody else is 14?
It's basically because in a care home, they basically want to do it sort of the double time. So we can risk assess. The advice we were given originally was we could risk assess up to 14 days because you could become positive on day 13. And then obviously you're still taking a risk. So the feeling is if you're still testing positive on day 14, then you go another 14 days and you will definitely be negative. So there is extra precaution because it's a care home setting.
Okay, thank you. Okay, that's all the questions from me. If we go over to comments, unless anybody's got any questions. No? Okay, so moving on to comments. Bill, you mentioned you had a comment. Do you want to go first? Bill, can you hear me?
I'm on mute. Is that all right? It's a senior moment ours again.
Okay, go ahead with your comment,
Right.
Bill.
This report is what we need. It's not too much in it. It's people can understand it, can ask the questions rightly. It's not pages or over pages. So I'm quite happy with the report the way it is. I'd like to thank you and Tanya because the work had done, and Annabelle if she was still here, because the structure alterations you've done in the department since March coming through. And we had the workshop with Tanya last month, so it was good. How you change, all the figures and the support people are saying, because I'm very supportive of the youth comments is how confident they are with social services. Now, this time last year, you wouldn't have had a comment of the youth and youngsters. They would be afraid of social services. But now, because they're talking, and we are more friendly and what we want done, I think is excellent. I think the report is what we need. The right report, not so much jargon there, right then, is what we can understand or questions you take it forward. But I'd like to thank all the department, all the staff, care homes, the work they've done in the last 6 months. I think it's marvellous.
Thank you, Councillor Smith.
I would second what Councillor Smith has said. I think all of us can understand what a challenging time this must have been for your department, particularly Lisa. So just to mirror what Bill was saying, really. So thank everybody on our behalf. And any other comments before we move on? No? Okay. Lisa and Taryn, are you okay? We'll move on now if that's everything. Are you guys going to leave the meeting now?
Yeah, that's okay. Yeah.
Yeah, that's lovely. Thank you both for your time.
Thank you. Okay, bye.
Thank you for the report. Thank you. Bye now. Okay, so moving on, we've got agenda item number 4. It is the work programme. As alluded to at the beginning of the meeting, originally Citizens Advice were meant to come to this meeting. Just to give you a little bit of context on that, I visited Citizens Advice as many other councillors did for their open day last year, and one of the workshops I went to, they talked about some of the difficulties that lots of people bring to them around council tax arrears collection. So that's where this agenda item came from. Unfortunately, the Citizens Advice just haven't got the resources to put somebody on it at the moment, because ideally what I would have liked is not only to visit the universal credit and the council tax arrears question, but also to sort of speak to them and get a bit of an update in terms of the impact COVID might have had and how it's affected their service. But so I think it is still an important agenda item, and I will continue to try to get them to the next meeting. But in terms of the work plan, if we can't get citizens' advice to the next one, having spoken to Maria, the suggestion is that we basically we have what have she's got here? Bear with me a second. We will replace it with we will bring forward the working life strand instead. So it's just to let you know that there may be some changes in the next month, but the work plan's always been fluid anyway, so I'm not overly concerned about that. And I think that's it on the work plan, unless anybody had any questions on the work plan. Bill, have you got your hand up?
Hang on. I take it off now. Sorry.
Okay. That's okay. Clive, you've got your hand up?
I have indeed. The agile working policy, which has gone through council recently, where and when will we be scrutinising that policy?
That's not actually in the work plan at the moment. Clive, would you like it to be added into the work plan?
I certainly would, because
Okay.
I think that is a matter that needs the utmost scrutiny.
So it's the agile working policy.
Policy, yeah.
Okay, I'll make sure that's added in then, Clive. I'll have little words with Maria and we'll rejig the work plan and I'll send it over to you.
Thank you very much.
Okay, no worries. Okay, any other questions or comments on the work plan? No? Okay, so agenda item number 5, scrutiny referrals, feedback and follow-up actions. In relation to the follow-up actions, as I looked at the action tracker that we introduced, and there doesn't seem to be anything outstanding as far as the action tracker is concerned, but there was something that I did have a question about really, and Gareth, maybe you can help me because you were kind enough to chair for me last time. It was to do with the question, I'm guessing it was raised in October's meeting. It was a question around the Civic Centre opening again. And if you notice on the action tracker, Andrew Mogford responded, he sent a response, and that action's now been closed down as complete. But Andrew's response, I wanted your feedback from the committee on what you felt, because from my perspective, I didn't feel that the response was sufficient. I just wanted the committee's feedback, starting with Gareth, really.
Can I intercept there, because I chaired the last meeting.
Oh, apologies, sorry, Clive. I thought it was Gareth.
That's all right. And to try and answer the point, I think the committee really wanted a particular report about this, which, you know, we've had comments, but I don't think that's sufficient, and perhaps other members were there will also add to that.
Yeah, does anybody else want to comment on that? Because it seems like me and Clive are in agreement. I don't feel it's sufficient, Clive. I mean, Andrew talks about, he alludes to the fact that regular risk assessments have been carried out, but we have no idea when the last one was. We have no idea because in theory, if you're regularly reviewing a risk assessment, each time you review it, you either increase the risk, or the risk is decreased, or you take certain actions, and we have no idea what those risk assessments look like and what the outcome was. So that's what I would be interested in. Does anybody else have anything to add?
Yes.
Gareth, go ahead.
Yeah, I think you're absolutely right, Tanya. we certainly need at least regular updates on this specific item. And I'm just wondering, I've briefly gone over the notes for the Neighbourhood Services Scrutiny Committee, and is it something that was introduced in that Scrutiny Committee? Perhaps Declan can come in.
Dec, you there?
I'm here. It wasn't raised in. I don't see why would it come under neighbourhood services, open to civic?
Well, simply because of the customer service sort of front-facing role that it has. But I do apologise if I'm mistaken, Declan.
I think that'd be more. Would it be regeneration? Maybe Andrew Barry could come in here.
Yeah, it's under corporate. It is. It sits under my portfolio. In relation to a report on it, specifics really, because it impacts on cashless council. It impacts on the figures that we've already got in terms of those using the civic and those who are going to our digital platforms. So, I mean, are we talking overall you want to examine the council reopening because of COVID, or are you asking about the specifics of having the council open to the public?
For me, Andrew, and the committee can come in after, but for me specifically, it was more around, when I saw Andrew's response, it was a sort of like one paragraph response, just alluding to the fact that they'd carried out risk assessments, and that's why the civic was still shut. So for me, it was very specific around the COVID. And I was in the market recently and I overheard one of the market traders complaining on the phone about it, about the fact that they're now open and, you know, things are getting back to normal, yet people still can't go into the civic and speak to somebody. So it was very specific around COVID for me. So I would be, for me personally as chair, I would be asking Andrew to give us more details on his comments. So when he alludes to risk assessments and the work that's been carried out, I would want more information around those two things. I don't know about everybody else. Clive, do you want to come in?
Chair, I've had my hand up for a bit.
Okay, Bill.
When we discussed this, they come back and the officer said that they're going to go around and check the staff for volunteers to open the front office, the reception area. Because once you open the reception area, then people can phone about different people and different, because they're working from home, they get in touch with them. It's easier for them than the staff. So I was waiting. So how many people did they ask? How many people said yes or no? So that's the question I asked, because I spoke to Mother Valley Homes as well, and they were home till the end of January. But as a comment they made earlier on, people are going out drinking, they're going shopping, they're in cafes.
Yeah.
And people want to know why can't they go, not in just reception there to ask the questions, because a lot of senior people want to pay for their parking fees a day, bits and pieces.
Yeah.
Letters been sent out, but they don't like paying by card.
Yeah, Clive, did you want to say something?
Yes, I did indeed, Chair, because I think as elected members, because I'm quite positive that each one of the 33 of us have had various people who, you know, couldn't understand, you know, the lockdown happened on the 23rd of March. And I know we've got, we're very busy at the moment with mass testing, and there's various staff involved with it. But nevertheless, we are a public service.
Yeah. And,
you know, trying to contact people, staff who are working remotely is one thing. For example, I don't think you can contact if there's 500 to 600 members of staff working remotely. Whereas if they were there, not all of them, but perhaps several of them in the Civic Centre, you can't get in touch with them directly. But if we're a front-facing public service, we should know all the reasons why it's totally impossible to have at least the reception areas open. Recently, last week, I went into Barclays Bank in Merthyr Tydfil, and I was pleasantly surprised that from the previous occasion I went in there several weeks ago, they had tightened up how they deal. In fact, there was 3 members of staff there carefully monitoring everyone going in there and making sure, for example, that they were at least the 3 meters apart. Now, I'm sure as a local authority, if we sat down and looked at all the issues and the risk assessments, we could deal with reopening. But as it is at the moment, we have no idea. We can't tell the public, yes, we got the plans and it's going to be open, we're going to do this, that, and the other. As elected members, we don't know. And frankly, we should know and have the reasonable answers for the public. So what we had from Andrew Mogford is not good enough, frankly. And we definitely need, and this is going to be delayed again for another few weeks, obviously, till our next meeting. But we should have a report and an officer there at the meeting on this issue, so that we can ask him all the questions that we've got. But at the moment, and I fully understand the apprehension that senior management have got, but it can be overcome, and as has already been explained by Councillor Smith, there's all sorts of organisations that have overcome it and are open to the public, with, of course, the proper risk assessments agreed by everybody.
Yeah, I'm glad I raised it now, Clive, because it seems like we're on the same page. I think we've all got concerns, and I think if there's clear rationale and clear reasoning, then show us what that rationale and reasoning is. I think that's what we're going to be asking for. So what I will do is I'll ask for that action to be taken off the action tracker as complete, because in my mind it isn't. And I'll ask for a report to be brought next month with more detail on the risk assessments, what the rationale is, and what the future planning is in terms of that reopening.
Yeah, and Chair, the appropriate officers should be there in the meeting, so we can all ask them, a number of questions that we all have at the moment. And if they, at the end of the day, if they put this report and the reasons why they definitely can't open it, well, we might have to accept it. But at the moment, it's been left in mid-air.
I'm sure Andrew won't have any objections to attending the next meeting. Clive, I'll certainly request it. Okay, Councillor Barry, did you want to say something?
Yeah, I understand the immediacy of the issue in terms of COVID. Did you want to expand that report to an overall view of the pros and cons of having the reception as it is, as opposed to sort of the digital aspect of dealing with the public as well? Because I think that's a valid reason to call the report, and it expands it somewhat, so you understand the detail behind the thinking of why it is as it is.
From my perspective, Andrew, I think that if you would explain a little bit more, Andrew, what you mean. Do you mean in terms of how the digital planning, which would have been there in before COVID, and now that switch to cashless, the switch to digital, that was all in the pipeline before? Are you talking about how that fits in to the risk assessments?
How that impacts on the usage of our reception area, and how those figures impact on, is our reception fit for purpose? Do we need to put the resource into it that we're putting into it? To look at, as we are at the moment with our agile working policy. Clive hits on a very valid point, and one that I'm really concerned about, in that if we need to get hold of officers, where's our telecommunications strategy in terms of, if you want to get hold of people, why can't we get hold of people? If we're going to have an appropriate agile working policy, it has to be seamless, so you can get hold of people as if they were in the office. So there's a much wider conversation, and I wondered whether you wanted to expand it to include that, or you wanted to keep it to the immediacy of just the COVID reaction.
Well, what this is telling me, Andrew, is that we've got a bit of a logistical / strategic issue here and a chicken and egg situation. So do we look at the agile working policy, which will throw up questions, and then we look at the front desk, or do we look at the front desk and then the agile working? My instinct is telling me off the top of my head is that if we give Andrew a huge sort of look at the digital thing, look at the cashless issue, look at the COVID issue, I think we may end up starting muddying the waters. From my perspective, what I would like to see happen initially is to let's look at these risk assessments, let's understand the rationale, and then that will no doubt prompt other questions. I suspect that will prompt questions on the agile working. It'll prompt recommendations from us as a committee around what we'd like to see from the agile working, which can then inform the next agenda item. So when the policy does come to us, we've already made a bit of a head start, and keep it quite simple initially. That's my thoughts, but I'll throw it open to the committee. Clive, what do you think?
Yes, I don't think we need to have this too complex at the moment. We've accepted earlier on that we'll have had the agile working policy on our agenda, hopefully at some time, and we can scrutinise that properly. That's one big issue. At the moment, I think we need to know the answers of how we get round immediate issues with the public, and that's access in the reception areas, both in Unit 5 and the Civic Centre. At the moment, and since March, we've been told, no, we cannot open them. We don't know, obviously COVID is still with us, but we don't know all the reason for that. So we need to concentrate, in my view, I think you're right, Chair, on that particular issue. Then whatever things fall on from that can be dealt with afterwards. But I say again, and I don't want to repeat myself, but the members of the public there, Andrew was quite right. There's frustration with people who say, I can't get through. I simply can't get through to the officer I want to speak to on such an issue. And as elected members, we haven't got the answer for it. Then on top of that, if the front doors are shut, they can't speak to anybody. And all I'm saying is, surely to God, as one of the largest employers in the county borough, if we can't overcome that situation with putting in particular stringent risk assessments, well, we can perhaps give up and go home.
Okay, thank you, Clive. I agree with you wholeheartedly on that one. I think it's strange times indeed when we all agree, isn't it? Okay, Councillor Lewis, and I think Councillor Smith wanted to make a comment as well. Councillor Lewis first.
Yeah, similarly, we do appear to be having too many barriers for the public at the moment, and of course that's not that may well be the fault of COVID, but it would be interesting to see how other local authorities have examined this and how they've proceeded. Perhaps we can learn from other authorities, or maybe they haven't, maybe they're in the same situation as us. So if we can have information on particularly how neighbouring authorities, RCT for example, Blaenau Gwent, Caerphilly have approached this, and that may be helpful. Thank you.
Councillor Smith.
Thank you, Chair. I support is do one at a time first, is sort the reception area out and find out the reason why people won't come back to work. Because we're all in town, we all go to the banks, we all go to the building societies, they got a set procedure. And if they wasn't open that long, we'd all be bankrupt, wouldn't they? So can we find out the reason why the staff have said no? Is it two issues?
Yeah,
Oh.
okay. So leave that with me, committee. I'll speak to Maria and we'll get the work plan altered accordingly, and I'll keep you informed and let you know how I get on with that. The good thing is that the work plan's always fluid anyway, but we purposely kept it. When I spoke to Maria at the start of the year and we were mapping everything out, we purposely kept it like this year because we knew that we would need that flexibility to be able to slot in things like this. So I think it's really positive that we can do these things, you know, as and when they come up. So leave that with me. I noticed there's hands up again. Guys, did you want to say anything else, or have you just not taken your hands down? Bill, anything else?
Oh, I've seen a moment.
Okay, no worries. Okay, if there's nothing else then, guys, agenda item number 6 is reflection and evaluation of the meeting. Any comments people wanted to make? Any reflections?
Oh,
No?
I said mine earlier on, so it's good.
Okay. And in terms of any other business, there was something that Maria wanted me to remind everybody of, and that was the fact that the deadline for the return of the self-evaluation forms is now being pushed to the 16th of December. So any scrutiny chairs that haven't done it yet, if they could get onto that and get it done before the 16th. I think that's all she wanted, really. Bear with me 1 second, let me double check. Oh, and just to say that the scrutiny support team has been advised that an additional column is to be added to the committee's work programme. The column would explicitly make the links between scrutiny reports and the core corporate documents. This will take effect from January 2021, which I'm sure as chairs you already know anyway. So if there's nothing else, guys, no other business, I shall call an end to the meeting, and thank you all for your time.
Good night, everybody.
Okay. Good night, everyone. Stay safe. Take care.
Bye.
All the best. Thank you.
Bye now.